health care legislation until Congress acts to put this country on a sustainable fiscal path. So it creates an incentive to put the country on a sustainable fiscal path in order to proceed with health care reform. We all know that the single biggest driver of our long-term budget crisis is entitlement spending. The President agreed that it is. He met with Republicans in Baltimore in January, and he admitted that entitlements are the primary cause of our unsustainable long-term deficits and debt. And yet, when Director Orzog was here testifying in front of this committee, he also said that the administration does not have a specific plan to address our long-term entitlement problems, that they're setting up a commission that would help do that. And he also admitted that the President's own budget is unsustainable. Under the President's budget, deficits never fall below 4% of our economy and end the decade at over 5% of our economy, in spite of the fact that the administration's benchmark for sustainability is deficits that are 3% of our GDP. Our debt is climbing to levels we haven't seen since World War II, and they represent uncharted territory in terms of how it will affect our economy and the ability of the world, as Mr. Campbell said, to absorb trillions in U.S. debt. And yet in the meantime, here we are today, taking this process that, if it goes to its conclusion, will thrust a new $1 trillion entitlement through Congress and onto the American people. The federal government already has $76 trillion in promises to the American people that are unfunded. These are unfunded liabilities. Now, this was computed by GAO, and it's $13 trillion over last year's estimate. So we can't afford the entitlements we already have, much less a new $1 trillion entitlement that will actually cost more like $2.3 trillion over 10 years if you start the year when the majority of health care benefits begin. Republicans need to take their share of responsibility. I've said that again and again for the entitlement problems we have, because they grew under Republicans' watch as well. But there is no excuse for using dollars from Social Security and Medicare to pay for health care reform instead of for shoring up the solvency of the programs that we currently have for future generations. The looming entitlement crunch will still be there after this debate, far after President Obama has left office and probably after most of us in this room are still in Congress, maybe all of us. But the decisions we make today, like whether or not to try and pass a $1 trillion entitlement by a razor-thin partisan vote, will determine the fiscal situation we leave our children and grandchildren. So it's time to dispense with using budget gimmicks to fit expensive legislation into a 10-year window and call it budget neutral when it's not budget neutral. It's time for honest and realistic budgeting. It's time for Congress to roll up its sleeves and tackle an issue that threatens the hope of prosperity for future generations. With that, I urge my colleagues to vote in favor of this motion and make sure our budget is on a sustainable path before implementing an undeniably expensive government takeover of health care. And I yield back to the maker of the motion, Mr. Campbell.
I thank the lady for yielding, and all I'd simply say is we disagree on